This show is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. The content on this show is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they have, and they should seek the assistance of their healthcare professionals for any such condition.
This is Rooted in Healing with Dr. Beth Claxton, exploring the science of functional medicine and the power of healing from within. Breathe in, breathe out. And now your host, Dr. Beth Claxton.
Welcome back to Rooted in Healing. I'm Dr. Beth Claxton. Today we're going to talk about gut health again. This is episode number 2. Debra, Meier, and I got together, and this episode aired on July 5th, 2025. And here we are 2 months later recording the second episode because we were only able to get through the normal things that happen in the GI tract. We were not able to talk about what happens when things go sideways, and that's what people also really need to hear about. So, quick review, normal GI tract. Our normal digestion starts when we smell the food, we start to salivate, we need to relax, hydrochloric acid and digestive enzymes and bile are made. We eat our food, we're supposed to chew it many, many times, like 40 times would be optimal. Do you ever count 40 times when you're chewing your food? Swallow, make sure that everything is out of your mouth before you take another bite. Then we talk about what happens in the stomach, what happens in the just after the stomach, an area called the duodenum or duodenum, and then the small intestines, the large intestines. So much happening. It's also important to remind people of the migrating motor complex, which is it's called peristalsis. It's the motion that the intestines makes. It's almost like a snake-like motion where the muscles, the smooth muscles, contract at one end, and then that sort of moves along through the tube of the small intestine that works all of the food down into the large intestines. And it's important to know that when we're eating, the migrating motor complex stops. So we aren't moving the small intestines while we're eating. So people that snack a lot or eat a lot of small meals, they may have an impaired migrating motor complex. This is why it's important to take space in between meals and not snack so that we can completely empty the stomach, the small intestines, into the large intestines before we eat again. Also the appendix. I don't even know if we talked about this much, but the appendix is like a gatekeeper between the small intestine and the large intestine, has a lot of rich lymphatic tissue that helps regulate infection from coming back up into the small intestine and probably helping to regulate what's coming from the small intestine, a more acidic environment, into the large intestine, into the colon. So again, story from my own health experience, because I can talk about my own health experiences. I can't talk about patients. There's this thing called HIPAA that keeps me from telling stories about other people, but I can talk about myself. So I realized that I had pretty significant gut imbalances when I started my Institute for Functional Medicine journey. We were given a free gut test to do with one of our trainings, and I did it and sent it in and had that free consultation. And the dietitian that was doing the consultation asked me, like, how severe are your digestive problems? And I said, well, I'm fine. I don't have any problems. And I actually ran across that stool test not that long ago and looked at it and thought, oh my gosh, I had a lot of imbalances. And I wasn't really tuned into that. I didn't realize what having a healthy gut really feels like. So that was a huge learning experience. A next huge learning experience was when, by happenstance, I got to see my mother's digestive stool analysis, my sister's digestive stool analysis. And my sister and I were both born naturally. So we were both exposed to our mother's microbiome, which is where we get the majority of the colonization of our microbiome, from the birth canal. And we all have very similar patterns. That was another huge learning point. I've also been on trips abroad, really mostly working trips. I tend to work a lot. I love what I do. So I worked in Mexico. I worked in New Zealand. I worked in Fiji, and picked up some illnesses along the way. And these, slowly start to erode the GI function. In residency, I remember running up the stairs, like in the middle of the night. So you're supposed to be sleeping in the middle of the night, number one. You're supposed to be fasting in the middle of the night. So I'd be running up the stairs in the middle of the night, eating something, running to a C-section, high-stress situation, so I could get through the C-section because I know I needed some nutrition, some energy to function in the middle of the night. So this lifestyle that persisted for 4+ years, not very good for that migrating motor complex, not very good for making healthy digestive enzymes and hydrochloric acid and breaking down my food. So it's really no wonder that I had crazy digestive results on my stool test. So I'm using myself as an example, but I just want everyone else to think about all the ways that we impact our poor gut. We don't sit down like the French do and have a lovely 5-hour lunch on Sundays outside under the trees. We're running around. We're eating at our desk. We're eating in the car. We're stressed out. We're listening to the news and wondering what's going to happen, and eating our food, which is not an optimal way to digest or bring in food and nourishment. And most recently, I was on a trip to Egypt and came down with something, and I did a stool test, and it looks like it was an E. coli infection. Thank goodness it wasn't a super virulent E. coli infection. But Deb and I will, go into this a little bit, and I wanted to give you a little background because I do mention that. I feel like I'm always doing a gut health support, but I think that we always should be paying attention to our gut and supporting our gut and looking for optimal function. Pooping every day is a great litmus test for how is gut functioning. And if it needs to be assisted with magnesium or coffee or whatever it takes, probably not as spontaneous and healthy as we would like to think it is. So don't be afraid, get help, and take a look at this, because there's so much that rides on optimal gut health. We have our skin, our mood, our sleep, our brain, and chronic inflammation inside the gut leads to chronic conditions like asthma, sinusitis, food sensitivities, joint pain. And there are lots of studies linking the oral microbiome to heart health and heart disease. So it's all connected to our GI tract. Our GI tract is how we communicate with the external world. We bring it into our mouth. It goes into our intestine, and that is translated into our own health. So today we're going to talk with Debra Meier, again, a fantastic, very talented GI specialist. She's not a gastroenterologist, but she's a functional medicine provider who does excellent GI health and really helps her patients heal. So please come back and join us. We hope you look forward to this interview. I know I am really looking forward to talking with Deb again.
For more information on Dr. Beth Claxton, visit bethclaxtonmd.com. And now, more Rooted in Healing with Dr. Beth Claxton.
Welcome back to Rooted in Healing. Today we have with us again Debra Meier. Debra is such a wealth of knowledge about GI health. We had an interview on July 5th, 2025, and we barely got covered the normal transit through the intestine and everything that's, well, a lot of things, the highlights of what's involved with that. Then we wanted to have a second episode and talk about the imbalances that happen with the gut, because so much of this is really important and affects all systems of the body. So Deb is a medical clinician trained to restore health and function, and her background is in 3 separate disciplines: functional medicine, nutrition, rehabilitation. And this education puts her in a distinctive position to guide all patients towards achieving their individual and unique health goals. Deb has a combined 30 years of hospital and outpatient rehabilitation experience, 16 years of nutrition consulting experience, and 10 years of practicing the systems-based biology approach of functional medicine. And currently, through the creation of her private practice called Philadelphia Personal Health, Deb combines services from all 3 of her fields of expertise. She targets each individual patient needs to maximize patient health outcomes, and the services she offers patients are truly personalized, whole person care approach. Welcome, Debra Meier, to Rooted in Healing.
Thank you. Thank you so much. It's a pleasure to be back. and I think you said it was July 5th, and now we're a little bit into September, so that summer went flying by, so hopefully everybody enjoyed their summertime.
Yeah. And so we left off talking probably, I can't remember exactly, but just the colon, how things leave the digestive system. And now we're back to talk about imbalances and what can go wrong, what can go sideways in this whole delicate chain of events.
Yeah. And there are definitely a number of things that can slowly create an imbalance, where some factors like food poisoning, we're going to talk about that in one afternoon, can sort of do a pretty big reset on your gut and leave you with symptoms that need to be addressed.
Yeah, and before we dive into specific things, I want to just take a moment and give a plug for the ancient wisdom of Ayurvedic medicine, which is Eastern Indian medicine, which says all disease starts in the gut. And as we've learned in functional medicine, after years and years, Ayurveda is 4,000 or 5,000 years old. As we've learned in functional medicine, we are all coming back to the gut, as research is showing there's so much in the microbiome, and so many, if not all, health conditions are linked to the immune system, which is 70 to 80% in the gut, neurotransmitters, 80 to 90% produced by the microbiome and in the gut. So much hinges on the gut being in balance. So when we have imbalances like food poisoning or these conditions, it's likely trickling over into our health in many other ways that we aren't recognizing.
Yeah, absolutely. Absolutely. And we both learned the deep dive into restoring gut health in school when we went to and graduated from functional medicine school with IFM. Mm-hmm. And it was great seeing the slides and everything on paper, but I can honestly say now, with 10 years of practice treating an increasing number of GI patients, that I have literally seen brain fog clear up, inflammation clear up, skin clear up, other infections, immune deficiency sort of symptoms where people get sick all the time. All these things, when we can rebalance and stabilize the gut and all the functions in there, as you just mentioned, seem to, significantly get reduced and go away. So yeah, I think it's the perfect starting point for so many of our patients to really address what's going on in that enteric nervous system, that whole ecology of the digestive tract.
Right. And finally, it seems like Western medicine is recognizing that the term irritable bowel syndrome is actually an ICD-10 diagnosis. And for us, it's kind of a trash can term. It means you're gut isn't working well.
Yes.
And then there's also
anything syndrome.
Syndrome.
A set of symptoms. Yeah.
And then there's irritable bowel disease, which are more severe conditions like Crohn's and ulcerative colitis. Those more severe conditions that really take people into a specialist and require medications. But that's really all that Western medicine has to offer them now is colonoscopies and medications. And and with the irritable bowel syndrome, let's dig into that and all the things that are associated with that. There's constipation, diarrhea, reflux. Like, what are the things that you see?
Yeah. The first thing, like, great distinction. And, I think that there needs to be a little bit more, and hence your radio program. I have so many patients that come to me and they're reporting that they, have these bowel symptoms and bloating, diarrhea, pain, cramping, alternating constipation, diarrhea, many of the things, indigestion, GERD, all the things that you just mentioned. Mm-hmm. But when they fill out their history form, a lot of times they check that little box that says irritable bowel disease. So they're not really, I think the general public doesn't just have a clear distinction usually between irritable bowel disease, which are the two diseases, and there's a few more, but the major ones, Crohn's and colitis, that are actually autoimmune diseases where your body is self-attacking parts of the GI tract, right? Mm-hmm. So, but in Crohn's disease, it's going to be somewhere higher in the GI tract, usually the small bowel, and with colitis or ulcerative colitis, it's an autoimmune attack down in the, can be the rectum or the large intestine, the colon. Both usually people put on medications that are immunosuppressive, which then have side effects. We've all seen the commercials on TV. So a lot of people are checking that they have irritable bowel disease, which, as you said, is a lot more severe, but they actually have irritable bowel syndrome. Now, irritable bowel syndrome, when something ends with syndrome, it typically means it's a group of symptoms. All the ones that we mentioned, the bloating, the gas, diarrhea, constipation, can be alternating, GERD, and brain fog seems to go with that a lot too. A lot of my patients who have irritable bowel syndrome have brain fog. But, to be a little bit more specific with irritable bowel syndrome, the newer research has pointed to that the vast majority of irritable bowel syndrome can be further categorized into something that we call SIBO, S-I-B-O, small intestinal bacterial overgrowth. And I see a number of GI patients, and I would say probably a good 75 to 80% of those patients that I see for those cluster-related symptoms do end up having a form of SIBO. And there are different types of SIBO that are out there. Then there's different ways to diagnose it. There's different ways a practitioner can go about treating it. So small intestinal bacterial overgrowth, the large category, is basically the overabundance of bacteria living in the human small intestine. The human small intestine should not be housing a lot of bacteria. We have something called a migrating motor complex, which is a system that sweeps bacteria, if it's healthy and functioning well, that sweeps bacteria out of our small bowel. Our small bowel is more for finishing digestion and absorbing food, and not so much for housing our gut microbiome. That is typically housed most exclusively in the large intestine. So when these microbes, and they can be bacteria, they can be fungal, they can be a whole different category called arachne, archaea live in the small bowel. That's typically what promotes the symptoms of SIBO. And those symptoms are gas, bloating, uncomfortableness, fullness after not much of a meal. Usually right after the meal is when people get those symptoms, and they tend to stay around for a few hours while you're in that digestive process.
Yeah. And so the archaea are the ones that tend to make methane. And there are all other...
something called IMO, intestinal methanogen overgrowth. And that's really associated with constipation.
Yes, and then there are a couple other types of SIBO, which are the kind that have to do with hydrogen, And then there's a relatively newer form that's hydrogen sulfide.
Yep, exactly. And the hydrogen sulfide is more associated if a person's symptoms are primarily diarrhea. And then, of course, these are all microbes, and there's not a clear line that you have to have only one or only the other. So we also get the mixing of that patient with diarrhea and constipation that have both sulfide overgrowth as well as hydrogen overgrowth, or methane overgrowth.
And the thing that I've learned about the hydrogen sulfide, and you see a lot more gut patients than I do because that's what you do almost exclusively, is they can have a lot of other associated symptoms like pain and neurologic symptoms, like bladder symptoms. Is that what you've seen?
Absolutely. Yeah, and there's a cohort of different types of microbes that are known to irritate the bladder in an inflammatory way, basically. And one of our standard go-tos for correcting SIBO and bacterial overgrowth, as you know, is something called the low FODMAP diet. And low FODMAP diet seems to be more effective with the hydrogen dominant SIBO and the methane SIBO. Not so much for the hydrogen sulfide SIBO, because sulfur foods, like broccoli would be great for some people, but if somebody had a hydrogen sulfide SIBO, any sulfur foods would tend to aggravate that too. So treatment has to be, a little bit different for those specific types of SIBO.
That's interesting. And sulfur-containing foods are the cruciferous vegetables, which are broccoli, kale, radishes.
Don't you? I know I get this, so you do this. You hear people talking about their diet and how great it is, and we all know that it's not. There is no right diet. It's the right diet for you. So careful investigation of symptoms and/or testing that reveals what your imbalances are, whether it's GI or something else, will lead someone like you or I to prescribing a diet plan that might exclude some foods that are considered superfoods, because for your symptomology right now, they're just, contributing to some of the imbalances and not helpful. But, you can return to those. Speaking of the low FODMAP diet, occasionally practitioners leave people on that diet for a long time, but I think about 3 months is the amount of time, and then we want to basically, wean them off and get them a more variety diet, or varied diet.
Yeah, keep them off in time to change the bacteria that are there, whatever that method may be, and then slowly transition them back onto regular diet.
Yeah, and exactly. And so I always tell people small changes, 1 or 2 things at a time, and observe and see how your body's tolerating that.
Right. And then how would someone test for SIBO? Because I know there are lots of patients that come to me and they say, well, here I went to my doctor and here's my stool test, and it's really ova and parasites testing. Or they had a colonoscopy and everything was fine.
Right, yeah. So the colonoscopy, the standard, right? So colonoscopy is important, obviously. They're more looking for structural issues, polyps, cancers, fissures, and slow motility. You can have obstructions you can see on a colonoscopy that could explain sort of a slow transit type of GI tract that would contribute to overgrowth. But in general, colonoscopies are more for that preventing of the bigger things, taking a little snippet, identifying if you have Crohn's disease, or looking for, making sure there's no cancer in the older patients. Anybody over 45 now, that's when the screening starts. So colonoscopies for SIBO, definitely not something that is going to detect SIBO, as SIBO is, as per the name, small intestinal bacterial overgrowth, is looking at the small intestine, which is right after the stomach, and the colonoscopy looks at the colon. So there are invasive tests to look for what is overgrowing in the small intestine, but with any invasive test, they're higher risk categories. They're more expensive. You have to get insurance coverage. The most common type of testing for SIBO, small intestinal bacterial overgrowth, is a breath test. So the breath tests aren't without failure. They have some false positives, false negatives. The patient needs to be compliant. There will be diet restrictions for about 12 hours before, and then there will be a testing phase where you drink. So these microbes that overgrow in the small bowel that are problematic, that produce methane, which methane is the gas that feeds the hydrogen, and hydrogen is the gas that feeds the methanogen overgrowth, as well as the hydrogen, the ISO, the sulfide overgrowth.
Right.
So these microbes that shouldn't be there, when they come in contact with the food that an individual ate, foods specifically that are high FODMAP foods, they're sugar-based foods.
Right.
What's going to happen is the overgrowth microbes are going to consume those foods, and then they're going to produce gas. Right. So they eat them up, they produce gas. The patient feels a lot of bloating, distension, probably fullness. By measuring those gases that are produced, we can identify what type of microbes are overgrowing. Is it microbes that produce methane? Is it microbes that produce hydrogen? Is it microbes that produce hydrogen sulfide? And then treatment's a little different depending on which of those gases. Now, a lot of gastroenterology areas, places, I don't necessarily know if they've gone to the full 3-panel gas test. I think most of them are still only testing for hydrogen versus methane dominant SIBO, and they're not looking at the hydrogen sulfide. Am I able to say a test that shows the hydrogen sulfide? Is that okay for the podcast?
I think it's fine. We're not endorsing them necessarily.
Yeah, okay, right. So there's a test called Trio Smart. That Trio 3 Smart looks at all 3 gases. So what the patient would do is they'd be on a restricted diet for 12 hours, and then they would have a solution of glucose, because remember, these are overgrowth microbes that love sugars. So they would drink a solution. Usually practitioners give glucose, but the shiny star in this area is lactulose solution. Right. Because glucose does absorb, lactulose doesn't, so we can get down deeper and we can really see everything that's going on. So they drink the lactulose solution, and then they have to collect their breath, like in increments of, I think, 20 minutes or so. Right. And they go to the lab, these little bottles of, air and breath goes to the lab, and they measure the type of gas and the amount of gas. And then the report will come back with, you do or don't have SIBO. It is a hydrogen-dominant SIBO. It is a methane-dominant SIBO, or it is a SIBO if you do the Trio Smart that has hydrogen sulfide. Now, that's one way to test using the breath test, which is pretty much the gold standard, I think, or the most common way to do it versus the biopsy from an endoscopy. And I used to do that way. I have adopted stool testing too. Also do it. So now the breath test, there's pros and cons with both. The breath test is going to tell you if you do it correctly, you follow the diet restrictions, the practitioner knows to give you the right, solution, the lactulose, and then you collect at the right time intervals, you'll get an accurate result the vast majority of the time. I don't know the sensitivity and specificity, but it's fairly high. So it's going to tell you what is overgrowing in the small intestine. I tend to, but it's not going to give you too many reasons why those microbes are overgrowing. So interviewing the patient helps with that. I do more stool testing. I used to do more breath testing. And the reason that I do the stool testing is because there's more clues to why you're unable to digest your food. That will create overgrowth. You have an infection that stops you from making acid. That will promote overgrowth. Your immune system in your gut isn't functioning. That can create overgrowth. So I sort of adopted just a personal strategy, right or wrong, there's different ways to do things. But on the test that I do, I can look at, the type of microbes that are overgrowing. And then it's a general overgrowth. It just doesn't have to be unique to the small bowel. But if I see E. coli or Klebsiella, I know that's hydrogen. They're hydrogen producers. Mm-hmm. If I see the Methanobacter family high on the report, I know they're the methane producers. And then if I see the Proteus and the Fusobacterium, I know that those are the sulfide, hydrogen sulfide producers. So there's different ways to get to what's going on and living inside you, and some of it is stool testing and some of it is breath testing. And then you need a careful, if the person has a lot of diarrhea and they come up high with Proteus and Fusobacterium, it all lines up as hydrogen sulfide. So I'm going to put them on a low sulfur diet, and I'm going to do some low FODMAP, and then I'm going to do specific treatment interventions to get rid of those things. And in functional medicine, we do something called the 5R. Mm-hmm. I don't know if you have any more questions, but we could talk about that more complete treatment, because it's not just enough to get rid of the microbes that have overgrown. You have to understand why the person got to that condition where microbes were allowed to flourish in the small intestine. And because if your gut is balanced, mm-hmm. and typically your gut is balanced if your life is balanced.
Yeah.
You're not going to have, you're not going to have, you gotta correct those imbalances to really keep, because the bugs are the what. The question is the why.
Yeah. I want to touch on GERD before we get into the 5 R's.
Yeah, sure.
So let's talk briefly about GERD, because so many people have it, right?
Yeah.
What do you
GERD, all capitals, GE, all these things today, SIBO, IBD, IBS, it's like a day of acronyms, right?
Right.
So GERD, GERD, gastroesophageal reflux disease. So GERD is a problem with, typically, it's usually a disease of a sphincter. The lower esophageal sphincter doesn't close. Mm-hmm. So, acid in the stomach is meant to stay in the stomach, and mm-hmm. GERD is often a reflux or a little bath of acid getting up into places it's not supposed to be in the esophagus, which is painful because the esophagus, unlike the stomach, doesn't have that big, thick mucous membrane it's supposed to have to keep it protected.
Mm-hmm. Mm-hmm. Yeah, and there's so many reasons. There's some easy reasons that can alleviate GERD, and there's some harder things. And normally, I would say when you have 10 minutes with a patient, 10 minutes max with a patient, as most Western medicine providers do, they're not going to have time to really sit down and talk about, like, what time do you go to sleep? Yeah. What time do you eat dinner? Do you chew your food? Right. What's going on around dinner time? How was your day? How do you unwind? Like there's 10 minutes right there. So they're just going to give them, medications that'll decrease their stomach acid.
The acid. Right.
Yeah, because then you won't have the symptoms.
In the short run is okay, but in the long run it can have consequences, including creating SIBO.
Right. By not having adequate stomach acid.
Right, exactly. And then you've got you don't have a higher acidity in your small bowel, and you don't have a higher acidity in your small bowel, and it leaves, these are microbes. They have survival strategy. They live in certain pHs. They like certain food. If you give them the environment where they can grow, reproduce, colonize, that's exactly what they're going to do. Mm-hmm. And not only do they take advantage of things like if you're on a PPI too long and antacid too long, but they also form biofilms. Like they have strategic ways for your treatments, whether it's antimicrobial or antibiotic, rifaximin, neomycin, to not be able to kill them and penetrate them. So that's something that practitioners need to know too, whether we're using antimicrobials or antifungals or antibiotics, that these biofilms have to be thought of too in order to make the treatment effective. Mm-hmm. So GERD, it's a lifestyle thing. It could be structural. It could be a hiatal hernia. Mm-hmm. Or it could be obesity, pregnancy, smoking. There's a lot of reasons for GERD. Fatty foods and then laying down, caffeine, alcohol, meals too big. delayed stomach emptying, stress-related, non-stress-related gastroparesis. So, yeah, there's the gut there's so many things with the gut, right? So that's why it really takes, you can try at-home strategies, which we'll probably get into, lifestyle, where you have good habits with food and all that. But if you are, if you're struggling, you might want to reach out to IFM and look for a functional medicine practitioner, or, talk to a gastroenterologist, or if any of your friends know a GI doctor that can go a little bit beyond the conventional 10 minutes, then those are all good things. Because there are home remedies, and there are things that make things better, but sometimes you do need professional intervention, professional testing, those types of things to really identify what's going on.
Yeah. Yeah, you've been helping me with my imbalances. Yeah,
well, and speaking of the number one cause of SIBO, which is food poisoning, you were trying to really have a good educational trip overseas, and food poisoning happened. And
right.
I don't know if you ever identified the bug, if it was E. coli or something else, but
I think it was
see
E. coli.
A lot of people that.
Yeah.
You think it was what?
I think it was E. coli.
Yeah. E. coli, yeah. E. coli does a number on things. So that is the number one probably bug that. So from a lifestyle standpoint, your lettuce, right? Your food, right? Are you washing things, right? If the potato salad doesn't look that good and it was out on the hot picnic table for a while, don't eat it.
Yeah.
Right? So just being cautious with not just dumping a lot of things in there, and being careful. And the better your gut microbiome is, like I said, if a bunch of people eat something that does have some E. coli growth on it, not everybody's going to get sick. So if you practice good habits and you have good commensal bacteria, they're the healthy ones. If you have a good mucosal lining, membrane, and a good immune system, as you pointed out, the vast majority of immune systems in our gut, you're going to be able to withstand that insult a lot better than somebody who doesn't have, hasn't taken care of themselves and doesn't have such robust defense mechanisms.
And talking about traveling, there are some particular probiotics that people can take traveling with themselves to help create the robust nature of a healthy microbiome, to help deflect any invaders that might want to come in on a leafy salad.
That's a great way to put it.
Yeah.
So, I think you like this one too. As a base support, a spore-based probiotic, because as far as travel too, spore-based probiotics, they don't need refrigeration. They're not so sensitive to breaking open in the upper intestine, the small bowel, or the stomach where it's acidic, which would kill a lot of bacteria. So spore-based typically transit all the way down, and then they start to populate when they reach a more alkaline environment. So they are getting down to where they're supposed to be before they populate. So the risk of killing them off, DOA, which dead on arrival in the stomach or the upper bowel, is much less for a spore-based probiotic, and they can proliferate into a lot of different types of beneficial bacteria. So that's a great base. But when I travel to Mexico with my family in November, I will be putting everybody on that for a month or two prior to going, and then I'm taking Saccharomyces boulardii with me, which is a beneficial yeast, and I will start people 3 days before on 500 milligrams of Saccharomyces boulardii. And this is not for everyone. That's just what I'm doing for my family. And that has been shown to significantly cut down travelers' diarrhea. There's the most research, I think, out there with Saccharomyces boulardii. So you would take that for the length of time that you were away in an environment. And then, of course, when you're in that environment, you're not having, water needs to be bottled. Don't get ice, right? It might not filtered. Ask the restaurants and the people do they filter their water, because it's I have a lot of patients that have to travel to Mexico on a repeated basis, and this is definitely a problem for them. They do better when they're on that Saccharomyces boulardii. And there's also evidence that if you get food poisoning, right? Like you weren't in Mexico, you were somebody else, but you have food poisoning. If you start with Saccharomyces boulardii, once you realize that you're sick, it actually really decreases the likelihood that post-infectious, whatever your bug was, that you are much less likely to get to get end up with SIBO after food poisoning.
Wow.
There's there's a number of things you can do if you get food poisoning. One is jump on the Saccharomyces boulardii. The other is natural prokinetics. You have to keep the gut moving to flush things out. You have to be hydrated. You can do broths, right, that help repair the mucosal membrane, right? You got to avoid spicy foods, space meals out. So many people eat these little tiny meals all day long. Well, then you don't really have good motility because your migrating motor complex that sweeps bacteria out of your small intestine tends to work when there's not food in the system, right? So you have to have space in between meals to clean things out. And if you're never taking that 4-hour break, then you're never really cleaning things up. So some Saccharomyces boulardii, some prokinetics, which just means movement of the GI tract. Magnesium is one, ginger, different ones are out there, can really decrease the likelihood of getting SIBO after an incidence of food poisoning.
Yeah, and
we all want to travel sometimes.
Yeah, and not that you always get only get food poisoning when traveling. So I ask everyone in their initial appointment, have you ever had food poisoning? And they look at me like that's done. Like, why is that an issue now? Because one incidence of food poisoning can really drastically change what's happening in the gut. So, a note to listeners, if you think that you've had food poisoning and you're over it, watch for symptoms. Yeah, keep that in mind.
Yeah, exactly. And what I've seen too, because again, I see a lot of people that are post-travel. I have a whole group in a corporation that they all have to go to Mexico 3 or 4 times a week, or 3 or 4 times a year. And my own family has a place in Mexico and Cabo, and they, at least annually. So after the food poisoning, when you're really sick, because your body's like, you get it in you, it starts to divide and sort of take over your intestine. And then you get sick, so you have diarrhea and maybe you have vomiting. It's your body's way of saying, we don't want this in here, let's get rid of it. But what I've seen, like a month or 2 after that, patients' symptoms die down exactly what you were saying. They don't ever still have that acute illness or sickness. Maybe they were sick for a week or so. And then, but when I do stool testing on these people, if I do it right away, they have massive amounts, right? Because DNA PCR can count, right? Like how bad is the infection? But if it's a month or 2 later, probably at least 50% of the time, I still see the E. coli or the Campylobacter or sometimes the Klebsiella still in the system. So, I don't have a timeline, but, what I'm thinking is that your body reacts intensely to a big amount of this, these microbes that don't belong. But after it sweeps out the vast majority of them, it kind of calms down and you go back to feeling okay. But it doesn't mean that presence is completely gone.
Right. It's drastically changed what's happening in the neighborhood. Yeah,
exactly. Right. Yeah, that's a great way to put it. Yeah. And there are some things called biophages, not to get in too deep, but there are specific probiotics that actually break the outer shell of E. coli and kill it, sort of like stabbing it, and leaks out all its contents. And my brother got really sick with E. coli; it was massive, and that helped him. There were a number of things that helped him, but it took a little while. I mean, it's a 40 to 100 trillion microbes in a healthy gut microbiome, and then when you get these infections, it's not going to be an overnight fix. It's going to take a number of interventions to reset the system, basically.
Yeah, so let's talk about those. You'd mentioned it before, the 5R program that we were taught in functional medicine through the Institute for Functional Medicine.
Yeah, so the gastroenterology team, which I always loved. I loved all the teams at functional medicine, but their gastroenterology team developed a program a while ago. I mean, I graduated 10 years ago, so this was at least 15 years ago that this program was created. And the 5 R's are for gut health. They call it Framework for Gut Restoration. The first one is remove. And I think conventional medicine is fairly good at the removal. Now, when they do a SIBO test, they'll prescribe the rifaximin. It's an antibiotic that isn't absorbed. It sits in the stomach, and it does significantly lower overgrowth bacteria, maybe neomycin, if there's different types, if there's methane dominant SIBO. So remove the bad guys, and I think we do that well, right, from a standard medicine.
I'd say adding a biofilm disruptor so that the bacteria can really...
Absolutely right. Yeah. Great point, because, again, it's a little bit frightening. These microbes are organizing and putting like a slime coat sort of shield around themselves, so the antibiotic, the antimicrobial can't get to them for eradication. So when you use a little bit of NAC, N-acetylcysteine, that's a good biofilm disruptor. Oil of oregano is also antibacterial, antiviral, antiparasitic, and a biofilm disruptor. When you combine those with your agents, whether it's conventional antibiotics or antimicrobials, the success rate for eradication of these unwanted microbes goes up significantly, and your amounts of rifaximin especially, you don't need nearly as much. So that's a great point. Yeah. So removal using a biofilm disruptor is even more effective than just the antimicrobial antibiotics alone.
Right. And then
people should expect not to feel great during removal.
Right.
So, right, because there's going to be die-off, and, we can stage it or, wean in or something. And, hydration, keeping your bowels moving, so important during the remove phase. We don't want things to sit in there. We want them to come out.
Yeah.
So, that's the remove.
And then replace.
Replace. Number 2 for functional medicine 5-hour program. The things that our body makes naturally in our digestive tract. We talked a little bit about the migrating motor complex. That's like a sweeping action. But in order to properly digest your food, there's 3 separate categories of digestive juices that are produced. The stomach makes hydrochloric acid, which is really important for breaking down our proteins. Also clean food, right? If you have enough hydrochloric acid and you eat something with a little bit of E. coli on it, it kind of has a good chance of killing it right there in the stomach. So we make hydrochloric acid in the stomach. We make bile acids, right? So the liver throws bile into the gallbladder, and the gallbladder pumps it into the small intestine. So bile acids help us break down fats and absorb fats. And the pancreas makes digestive enzymes, amylase, protease, and lipase, and those 3 things help us to digest our proteins, fats, and carbs. So we have these, digestive fluids that are made in the stomach, pancreas, the liver, that need to be pumped into the system in order to break down foods completely. Because if we don't digest, we won't absorb those foods. And malabsorption is definitely a component of overgrowth, because what we don't utilize as a human, those foods continue down the GI tract, and they will overfeed the gut microbes. Now, again, with the stool testing I do, when I see staph and strep overgrowth, I think you're not digesting your food very well, and almost 90% of the time I see low digestive enzymes. When I see enterococcus overgrowth, typically they overgrow in a low acid environment. So depending on what your overgrowth microbes look like, you can kind of point to why that they've been able to flourish in that environment. So you really want to have your body produce digestive enzymes, hydrochloric acid, and bile acids. Now, I know from being in classes with you that you're a fan of bitters. And bitters are some natural products. They're botanicals. They're made from plants that help us make these different secretions. They help our body to create digestive enzymes, hydrochloric acid, bile acids. And people do a little bit of bitters before they eat. They can increase their motility. They can increase their bile, their stomach acid, their digestive. And there's all kinds of things that are bitters. Usually you get like a little tincture kind of thing, like a little dropper bottle or something. Are you doing bitters right now? Do you do like a little specific, like liquid sort of dropper? I don't do them myself.
I'm not doing them right now, but I definitely have them. And the reason I like bitters is it's like Ayurvedic medicine. It's got got a bunch of herbs in it that stimulate naturally the body to release more digestive.
To do what it's supposed to do, right? And we talked about it in the first episode. The vagus nerve's important too, right? So the bitters are going to stimulate all these organs to do their thing, but you have to be relaxed. You've got to have some vagal tone. That vagus nerve, cranial nerve 10, innervates all these organs. So, if you're in a fight or flight when you're eating, right? You're not really making your own juices as well as you should. Now, you know that I'm doing more and more work in the longevity space, and it's really sad, you know, because I'm 60 now, 61 actually. I just told everybody that. But so we don't make as much stuff as we used to, right? Like you're a specialist with hormones, women's health. We're not making the estrogen, the testosterone, the progesterone like we did when we were younger. So hormone replacement therapy. Well, you know, bitters or digestive enzymes are different things as we age, and it's usually around 50 where we start to see low hydrochloric acid, right? So, and low digestive enzymes. So, you know, there's a lot of different things that contribute to a gut that's not just it's still working, but it's not at 100% anymore.
Yeah. So we have just a little bit of time. We have 3 more, and I know you really want to talk about the last one. Give a good plug for it, the rebalance.
Yeah. So the third one is reinoculate. You know, put the good guys back in. That's we talked about the
probiotics,
the spore-based probiotics, right? And then repair. You know, you might need a professional to know if you've got leaky gut. Basically, there's a lot of tests out there. You could talk to a functional medicine person. They're probably not going to do that in standard medicine. And then the last one is rebalance, right? So I'm so much better at this now with my patients to tell them. I had a person today who I saw 2.5 years ago, cleaned up her gut. She went back to bad habits 2.5 years later, which isn't bad for reoccurrence with the SIBO. She went back to some bad habits. Now she doesn't feel well again, right? So rebalance. So the microbe overgrowth is the what. And, you know, functional medicine, we're all about the why. Like, okay, you have this going on, but why? How'd you get there? So lifestyle choices, not chewing your food, rushing, being too stressed, you know, eating foods that are processed, right? They create a lot of bad bacteria, right? Processed foods. Stress, right? So when you rebalance your life, good food, good friendships, relaxation, this is Ayurvedic too, right? I would assume, I don't know the exact name, but your gut functions so much better. You're in line with nature and how you were intended to. Michael Pollan, right? There are no junk foods. There's junk and there's food. Also, Michael Pollan. He's got a great book called Food Rules. It's very small. Eat at a table. A desk is not a table. Americans, we just drive. We put food in our mouth. We are on a lecture. We put food in. You know, we do all these things, and we don't allow a time to eat and breathe and digest and relax, right? Rest and digest. Yeah. So rebalancing your life is what's going to prevent, you know, I sort of use the monetary thing a little bit with patients. I'm like, spend all this time and energy to fix this, and you're going to feel good. And most of the time they do. I'm like, you don't want to go back there. You know, there's a reason you came here in the first place, and you don't want to go back there. So it's a lifestyle change, right? It's not a treatment with 1 dose of antibiotics or 1 dose of antimicrobials. It's understanding how the body works and living in alignment with those natural principles that a lot of them are ancient, right? We have to start living like humans again, and not, you know, modern society can turn off the news, you know, when you're having dinner.
Yeah, I actually just for a couple of weeks stepped back into Western medicine and helped out at a small hospital that needed some labor and delivery coverage. Oh, I can see every time I decide to do that, what it does to my body. It's so stressful.
Yeah, I was working in a busy clinic, didn't have that much time for lunch. Then, of course, I want to run my errands too. And I was like, I'm belchy, I'm burpy, burping right after a meal, often not always a sign of low acid. Burpee and indigestion an hour or two, often a sign of low digestive enzyme output. So like the timing of your symptoms can tell you sort of what's going on too. So yeah, we all need to, and most of the people I see for digestive work, they're not the guy sitting in the basement or the girl like with their feet up at mom's house. Right. They're movers and shakers, right? Yeah. They're like out there, they're in go-go mode all the time, and they need to really decompress, especially when they eat.
Yeah, so true.
Yeah.
Anything else?
You're a go-goer. I've known you long enough to know you're a AAA personality.
AAA. So, Debra, is there anything else you want to add before we wrap it up?
You know, I think this has some relation to gut, but kindness. We're living in a world where kindness is sort of at a premium, and you know, when you act well and you are kind to someone else, it actually Marianne Williamson, be kind to others, not just for their sake, but for yours, right? Mm-hmm. So like living in harmony with your body, but with other people, right? Mm-hmm. That community, right? Like have a meal with some people and friends and relax and let your problems go until, and the more you can, reach out and be part of the solution, like what you're doing with this podcast, right? Mm-hmm. This radio show is part of the solution, right? So we all need more humans that are living in that space, basically.
Thank you. Thanks for joining us. Yeah. And we'll go to commercial break and be right back in just a couple minutes.
And now, more Rooted in Healing with Dr. Beth Claxton.
Hi, this is Dr. Beth Claxton. Thanks again for coming back. We had a great interview today with Debra Meier, who's a really talented provider out of Philadelphia. She's changing her practice, adding to her practice, longevity medicine, which is going to enhance the GI health work that she does. I wanted to recap her interview with just a few habits to take home with you, because these two interviews that we did that you can find online on the podcast links have so much information, and they can be overwhelming, and it's almost like too much to think about. But here's some easy things that you can do at home with your next meal. Chew your food. Stop, relax, and chew your food. And if you're up for it, count to 40 chews before swallowing. Empty your mouth before you take the next bite. Also, try not to drink too much water or any liquid right after a meal, because it dilutes all of the stomach acid and digestive enzymes and bile that's there. So drink the majority of your liquids before a meal or a couple hours after a meal to allow optimal digestion and mixing with everything that our body makes to break down and digest our food optimally. Then take some time in between your meals. Take a rest. Let the body digest. Let the stomach empty. And let the migrating motor complex move everything down. Let it empty the small intestines, which is optimally 5-ish hours after having a meal. If you can wait that long, we're quite conditioned to immediate gratification with our food, and there are so many things it's so easy to reach for. Take some deep breaths throughout the day. Stop. Take some deep breaths. You can do 6 really deep belly breaths. You can do box breathing, which is in for 4, hold for 4, out for 4, hold for 4. These are really easy ways to activate the parasympathetic nervous system, improve digestion, get that migrating motor complex going, and really help your digestion. Get plenty of sleep. Turn off the TV, the radio, the computer when you're eating. And there you have it. Our little nutshell things that you can do at home right now with your next meal. Please come back and join us. We're on every Saturday at 9 a.m. You've been listening to KAZM Mellow Mountain Radio on 106.5 FM, 780 AM, Rooted in Healing. And I want you to think about, let your mind explore the things that make you happy, the things that bring you joy, the things that make you feel vibrant, and live your life in orientation to that, because we all need more happiness and joy in the world.
For more information on Dr. Beth Claxton, visit bethclaxtonmd.com.